Welcome to the Barasch McGarry 9/11 sanitation webinar. We represent over 1,000 sanitation department workers, both active and retired, many of whom were retired before 9/11, but came back to help out. And we're thrilled to put on this webinar. I'm Michael Barasch. It's a pleasure to see you all out there. With me today from my office are my partners, Dom Penson, Dana Cohen, James Steiner, and Lee London. And we're also joined today by Liam Lynch of NICOSH, and Liam will tell you what NICOSH is and how valuable an asset it is for you. Also with us are Julie Raskin and Maggie Lee of the Sanitation Foundation. And finally, we have with us Austin DeSavino of the American Cancer Society. So welcome, everybody. And would you please start us out with a short video about our relationship with the Sanitation Department and what we were doing with them and with the Sanitation Foundation during COVID. Let's start with that.
New video shows New York's strongest getting a much-needed delivery of PPE. Sanitation workers applauded as they received a donation of masks from the law firm Barasch McGarry. The firm, which represents 9/11 victims, is donating 50,000 masks to essential workers and first responders.
By the way, that was at 4 o'clock in the morning. It was fun, and we were happy to do it. Let's start us out. Hi, Sal. Thanks for joining us. And let's start with the short video about the Victim Compensation Fund and the health program.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
It's also critical that we reach our students and our staff members, our teachers who were in the schools 18 years ago.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
Our law firm now represents over 25,000 people in the 9/11 community.
The majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
All right, so I want to start with Julie and Maggie of the Sanitation Foundation. Welcome, guys.
Thank you, Michael, and thank you for your support over the years. I'm Julie Raskin. I'm the Executive Director of the Sanitation Foundation, and we are the official nonprofit partner of DSNY. We're relatively new. We were founded in 2016 under the name Foundation for New York Strongest, and we've grown pretty rapidly over the last 2 to 3 years. So our mission is twofold. On one hand, we focus on helping the city achieve the goal to send zero waste to landfill. So that means kind of engaging the public with recycling and composting, sustainability. But the other part of our mission is helping New Yorkers understand and appreciate and really celebrate our essential sanitation workforce, and really tell the story to the general public of everything that happens behind the scenes at DSNY to keep the city running. So this fits squarely in that part of our mission. A lot of everyday New Yorkers don't know the role that sanitation played in 9/11 and the recovery. So Maggie's going to tell you a little bit more about some specific programs we have right now.
I am the Director of Cultural and Educational Programs for the Sanitation Foundation. Something that I'm sort of very proud and humbled to have created is DSNYremembers.org, which is a digital exhibit that is sort of hopefully working to address the sort of gap in the narrative of like what DSNY's role was at that time. A couple of things coming up. We're talking to the 9/11 Museum about having another DSNY day on May 16th. That would be free tickets for the DSNY community to visit the museum. I'm also expanding DSNY Remembers out into a short documentary, which we need to work out when, but we're going to try to do a screening of that at the museum as well. The museum was also interested in if there are any people in the DSNY community who would like to share the story, potentially be profiled on social media. We would like to hear from you guys. So if anyone is sort of interested in and comfortable talking about their DSNY story, please reach out. I would be happy to speak to you. If not for the social media thing, just in general, I'd be happy to hear from you. You could reach me at Maggie@sanitationfoundation.org.
Thank you for that, Maggie. And now, Sal Annerino. So Sal, welcome to our, you've been a big supporter of sanitation workers who were sickened by the toxic dust. And I want to thank you for your advocacy and for everything you do. Can you tell us a little bit about your story? And I think it's one that Maggie would find so interesting for the museum.
Hi, my name is Sal Annerino. I was a district superintendent for New York City Department of Sanitation. On 9/11, I was an extra super for the day. I was up on 215th and Broadway, and I helped one of the districts get their trucks ready to go down. The next night, I left out of Bronx 4 and escorted about 300 sanitation workers from the Bronx, from the west side of the Bronx down there. We had in the beginning over 2,000 workers there. We were
2,000 sanitation workers, Sal?
Sanitation workers.
Wow.
Front end loader operators, flushers, collection trucks, all different kinds of equipment. Our main tool in the beginning was the flusher to keep the dust down. We were running out of Manhattan 2. We were running a hauling operation. Out of Manhattan 3, we were running a cleaning operation. I remember standing in front of the firemen and the other volunteers on the piles, and I wanted to make sure that they didn't get soaking wet. So I would stand in front of the flusher right next to these people, and I would pull the flusher right into me, how far to shoot the water. And I just was covered in dust, and I ate that dust. We were down there for almost 2.5 months before we got certified for masks. So by then it was useless.
But
They kept,
Sal, the EPA said the air was safe.
yeah, I was just going to say that, Mike. The EPA told us the air was safe. Don't worry about it. We have lost 106 souls so far that worked for us down there that we know about. I'm sure there's many more that we do not even know about. There are a lot of us that are very sick. I personally was told in 2014 that I had lung cancer and dealt with that for 7 months. And luckily for me, I got a blessing from a priest on a Sunday, got a call from the doctor on the Monday to do one last CAT scan. I never heard a doctor cry so much, but she told me my surgery was canceled, that it started to shrink. And 6 months later, and a year later, it was all gone. Also, 3 lymph nodes on my abdomen. The same thing happened. My wife was a volunteer. She used to go down there, not right in the beginning, but later on. She would go to the mass with me on Sundays and at the cross. And then she would go over to St. Paul's Church and help out any way she could over there. She ended up with ovarian cancer that was blamed on being down there. For those of you who don't know, I posted it on all my groups. I run 5 groups. If you are picking up garbage or recycling below Canal Street, you are entitled to be part of this program. So I was talking with Mike earlier about that. I run a Facebook group. It's called the Remembrance, WTC Remembrance of Souls We Have Lost. We have 659 members. And I am always available. My number is 347-203-7922.
That's great. All right. So I want to move on now to Liam Lynch of NICOSH. Hi, Liam. Liam.
Hey, guys.
Would you tell everybody what is NICOSH and what does it do?
Yeah. How's it going, everybody? It's always an honor to be here. So NICOSH is a nonprofit in New York City. We're made up of labor activists and worker advocates, safety and health specialists, and we're all fighting for healthy and safe jobs in New York City. We're advocating for stronger worker protections, especially in this time of COVID. We've trained a lot of workers in numerous safety and health topics, from workplace violence, infectious disease, OSHA trainings. But we were there, my predecessors were there in the early days after the attacks, advocating for responders and survivors, that they should absolutely receive the care and compensation that they deserve. And so we do a lot of outreach and education that responders and survivors are entitled to healthcare and compensation. Particularly, we focus around the World Trade Center Health Program, which is one of the 2 programs that we're here today to talk about, right? And the World Trade Center Health Program provides no-cost, free medical screening, treatment for health conditions related to your 9/11 exposure. And like we've said, it's not just for responders, but it's also for survivors as well. There are many, many different cancers. I believe 68 cancers that are covered in the program. And in the healthcare program, these are not just any doctors or healthcare providers. These are doctors, physicians, nurses who specialize in treating 9/11 responders and survivors, and who understand the unique circumstances of the conditions, of the experience that this population in this community has had. And this experience, specializing, treating this community really is what I think makes this program stand out. Obviously it's free, but you're receiving really, really highly specialized care. And if you're in the program, you also can opt in to share your patient data. It's not required, but you can share your patient data to researchers who are researching how we can better care for this community now and into the future, because this healthcare program is going to outlast us all. It's here to stay. And so if you partake in the research component of the healthcare program, that's definitely a service to your country. So, specialized care, what do we mean by that? Treatment for 9/11 related conditions, and there's over 100 different conditions that they have linked to 9/11 exposure. Your treatment is going to cover medical tests, doctor visits, surgeries, prescription drugs. And also there's a really robust benefit counseling program as well. So it's really a comprehensive care that you're getting. And this is not just a static program. It's designed to evolve with the changing needs of its patients. And lastly, I'll say that this program is not just in New York City. It is a nationwide program, and responders and survivors are receiving care in all 50 states as we speak. But if anyone needs help and hands-on help, applying to the healthcare program so that they can then access that compensation, NICOSH is always here. I'm always here. So we're here to help this community who has done so much to help us.
I'd like to talk a little bit with Austin of the American Cancer Society. Austin, first of all, thank you again for joining us today. Would you first tell us a little bit about American Cancer Society, what it does for cancer patients? You heard that 68 cancers are presumed linked to the World Trade Center toxins. That means even if you were a smoker, even if you had a family history of breast cancer or prostate cancer or skin cancer, which happen to be the three most common cancers, the health program and the victim fund will presume that you were sickened by your exposure to the toxins.
I'm really happy to be here. Thank you again, Michael, for allowing me on to talk about the work that the American Cancer Society does. And before I get into that, I do just have to say I was so excited that this call was with DSNY. One of our greatest partners and teams in Central Park at our Making Strides Against Breast Cancer walk, we love the Department of Sanitation. So it's great to see some faces, and I'm happy to be here. Like Michael said, I'm with the American Cancer Society. I'm a director of development here in New York City. And a lot of people recognize our logo, they recognize our name, but not a lot of people know what the American Cancer Society does. So with the funds that we raise, a lot of it does go to research. The only people that put more money towards research is the United States government. We have funded billions of dollars of research. We have funded over 45 Nobel Prize winners. But aside from that, our money goes into resources for cancer patients and their family. We are there from prevention through all the way working with caregivers and the family members of cancer patients and survivors. The biggest thing we have is the National Cancer Information Center. And really, you can call us for any cancer-related question. You can get information about specific cancers, treatment options, side effects, medicines, pain control, clinical trials, resources such as tobacco cessation programs, patient navigation, which is, imagine you get diagnosed with cancer. It's like, okay, what now? What do I do? Who do I talk to? Where do I go? Call us. We are there to help you and your family every step of the way. One of the other resources we offer is the Hope Lodge, like Michael was referencing. There's over 30 of them across the country. I work out of, not right now, but when I'm in the city, on 32nd Street, we have a Hope Lodge, which is essentially a hotel for cancer patients and their caregivers. You can stay with us for free as long as you need to. And those are just some of the things that ACS does. Again, cancer.org, 1-800-227-2345.
All right. So thank you for that. And as you know, I'm a big fan of American Cancer Society. You guys are terrific. All right. So Lee, I'd like to start with talk a little bit about the Victim Compensation Fund. And we've already talked a lot about the health program. But can you tell us, first of all, who is eligible? And also, can you talk a little bit about what Senator Gillibrand discussed, which is the different boundaries for the health program and the victim fund?
Sure. So DSNY, sanitation, first responders, civilians, employees, volunteers, all qualify. Sanitation was there. And I always have to remind every new caller I get that work for the sanitation department, because they always call me And it's like they're asking me a question whether or not they qualify, when they qualify just as much as an NYPD officer, FDNY, EMT. Sanitation was a huge contingency of cleaning up all of the debris. Who else was going to clean up all of the debris, not only from the building coming down, but the building destroying other buildings? And everybody was throwing out everything. And the reason why Sal stated that if there were crews that responded on the first day, there were crews from sanitation that responded 3 days later, 5 days later, then there were crews that always was in the 9/11 exposure zone. So the Victim Compensation Fund is anywhere south of Canal Street. So if you were a sanitation worker, a civilian employee, a volunteer, and you went below Canal Street or you worked below Canal Street, you qualify. You have to ask questions and you have to call us even if you think you might qualify. The special master has said in many videos, register. Even if you're healthy, register now. We want to secure your proof of presence. We want to be able to obtain documentation from you on your medical conditions. So we don't want people starting this process when they get that, oh my God moment. We want people starting this process now and to get registered. But one thing that I wanted to say is that DSNY has volunteers. Volunteers are also eligible under the fund, okay? So concerning proof of presence documentation, if you were active sanitation at the time of 9/11 and you responded to 9/11, you would have something called a Miller letter. It is also called a DSNY World Trade Center memorandum, okay? This memorandum is an amazing proof of presence piece of documentation. Many people don't know if they have one. That's why I'm encouraging anyone to call us, because after doing this for so long, we were able to obtain contacts from the DSNY that can confirm if somebody has this documentation on file, and we can help them create this documentation on file if they have proof of presence. So please call and please get it to word out, because I just signed up a sanitation client that he wasn't active sanitation at the time. He was a student in the zone below Canal Street and then started working for the sanitation department. He would qualify as a survivor in the zone, because if you worked, lived, resided below Canal Street, you still qualify. And we have to be each other's advocates here.
Lee, would you please talk about the geographical boundaries for the health program? It's a little different.
Yes. So for the World Trade Center Health Program, it is different boundaries. It is below Houston Street. So you would qualify for the health program if you were below Canal Street, but you didn't get below Canal Street, but you wouldn't qualify for the Victim Compensation Fund. The reason why Michael is stressing this so much is there's so much confusion on the World Trade Center Health Program, the Victim Compensation Fund, the health registry. But I want everyone to see the boundary lines, because if you worked below Houston Street or if you worked in Brooklyn, you would qualify from the health program based on this map, but you wouldn't qualify for the VCF. But if you were below Canal Street, you would qualify for both.
Okay,
So,
and Lee, can you please talk about the landfill?
Sure. The Staten Island landfill is also a designated covered zone for the World Trade Center Health Program and the Victim Compensation Fund. And the Staten Island landfill had many sanitation responders. Also, not just the sanitation landfill. Now, the DSNY is special because if you worked on contaminated vehicles outside the typical zone, you qualify, okay? And these are garages. These are places where they stored rubble and equipment. These are places where the dumpster trucks were being held, that people worked on contaminated equipment. We have many clients that did work outside the typical zone, but do qualify.
James, I want to ask you to talk to the next slide, which is about the benefits of the Victim Compensation Fund. I mean, this isn't just about money, and we've been very clear that the health program is just as important. Even if you have health insurance, I don't have to tell you that chemotherapy bankrupts people every day because their insurance just doesn't cover it. So let's first talk about the Victim Fund. James, would you tell us a little bit about this?
Sure. So you heard Liam do a great job just telling you about how anyone who was sufficiently exposed to these toxins would qualify for the World Trade Center Health Program. And there, get free medical care, treatment, prescription coverage that they need for their 9/11 related illnesses. Once the World Trade Center Health Program certifies that your illness is 9/11 related, that's when you're able to go to the Victim Compensation Fund, which is that separate program, and get actual monetary compensation for your diagnosed conditions. So claims typically have multiple components. Every claim sort of has this base foundation of a component for pain and suffering, and that award ranges. It depends on the severity of your illness. You see here on your screen for non-life-threatening illnesses, non-cancerous conditions, awards range from $20,000 to $90,000 depending on the severity. And unfortunately, when you're talking about illnesses in the 9/11 community, you're also talking about terrible cancers. And in those cases, awards range from $200,000 up to $340,000, depending on what type of illness you're diagnosed with, what type of treatment you have, and the different factors that come into play. But especially for DSNY workers who were on the pile firsthand breathing that toxic debris, you see people who are diagnosed with terrible conditions that are actually disabling. If NYSER says that you are disabled by your 9/11 related conditions, then in addition to filing a claim for your pain and suffering, you're also able to file another claim for your loss of income. And think about it this way: if you are, a young guy at the time you're exposed, and then 10 years later you're diagnosed with cancer, you're found disabled at 45 years old, 50 years old, you're able to go after potentially 20 years worth of your lost earnings, which is a considerable amount of money. And that's when you see these awards add up from the hundreds of thousands, potentially into the millions of dollars. So it is definitely, look, early detection is the best medicine, and that should encourage people to go to the doctor. But sometimes people don't, and they need a little extra incentive, and you have that here in the financial aspect of claims. Another important thing to note is, some people may say, well, I only have asthma now. I don't want to file a claim because what if I'm diagnosed with a more serious illness later? The good news is that this fund is now permanent. It was extended until the year 2090, which means you can file a claim for your minor condition now, say something like an asthma or respiratory illness. And then God forbid, if you're diagnosed with a more severe condition down the road, you can always go back and amend your claim to account for that new condition or any change in circumstance if, God forbid, you're found disabled down the road. So you never waive your future legal rights to file a claim or change your claim in the first place. And another thing I want to note is that we sort of touched on this briefly earlier, is that the law presumes that your illness is 9/11 related. So if you are, maybe you have a family history of a certain condition and you say, my doctor's not sure whether or not my cancer was caused by exposure, that really doesn't matter, because if you were down there and exposed to the toxic debris, the law is going to presume that your illness was caused by that exposure and make it so much easier for us to file a claim on your behalf. So the last point I wanted to mention is that these claims generally take a year, sometimes longer, depending on the evidence you have to support the claim, where you are in the certification process. But keep in mind that there are things we could do to expedite a claim if, God forbid, you are in critical health as a result of any 9/11 related illness, or if, God forbid, you are in terrible financial circumstances. We can get the VCF to expedite the claim and rush it. And instead of taking a year, it can take only a matter of weeks. So, if you have questions about anything about this, give us a call. We want to help you out however we can.
Thank you, James. So that's a perfect segue into my partners, Dom and Dana, who run our firm's family assistance team. And sadly, not a day goes by without one of our clients dying. More people have now died of 9/11 illnesses than the 2,977 people who died on 9/11. So this is something that you need to protect your families. So Dom and Dana, would you please talk to us a little bit about the wrongful death claims?
Thank you. But before we do, I just want to add one thing. The leading type of cancer that the World Trade Center community has gotten is skin cancer, and especially for sanitation workers. I think that when we talk about COVID and the effect that it's had upon missed medical appointments, that's really an important thing to remind everybody of. because sanitation workers get a lot of exposure on their skin, got a lot of exposure on their skin to the debris. And so please, go and get an annual skin check. Unfortunately, the health program does not provide that, but it's vitally important for everybody annually to see a doctor and have their skin checked. So I just wanted to put that out there.
No, and I'm glad you did, Don, because so many people, as you know, will say to us, oh, I didn't have cancer. It was just basal cell or squamous cell. Well, that is skin cancer, and you're entitled to $90,000. But more important, it gets you into seeing a doctor every 6 months, which is what you should do. And it doesn't matter the pigment of your skin. We have plenty of clients of African-American descent who have skin cancer. So please, we urge you, go for an exam. Go ahead, Don.
Thank you. So with respect to the type of claim that one could make, or their families could make, if somebody passes away from one of these World Trade Center illnesses, is not only could the family collect any award or benefits that the victim could have collected in life had they brought a claim. Let's say they didn't bring a claim. The family can bring the claim that they could have brought. The family can also bring a second claim, a claim for wrongful death, and that's to recover for a number of things. There's additional benefits for the family for any lost income. There are benefits for surviving spouses and children, dependent children, for their pain and suffering from the loss of their loved one. There are benefits for what's called replacement services. That's compensation that the family may be entitled to for the loss of services around the house that their loved one used to perform. There's reimbursement, as you can see on this slide, for funeral expenses. These benefits can be very substantial. They can add up to hundreds of thousands of dollars. They can add up to millions of dollars, depending upon the particular circumstances. And Dana is going to discuss with you what we can all do for our families should they ever need those benefits.
So Dana, would you please talk to us about what should people do now?
I want to say that it's a special honor to be on this panel with Sal Annerino. Because working with DSNY families, there's one name I hear over and over again from families, the person who's helping them, and that's Sal Annerino. So he's earned his wings, that's for sure. One of the things you should do for your families is give them Sal's number, because if something ever happens to you, he's going to help them. I've seen him do it over and over again, and what an important resource he is to the DSNY community. You want to speak to your family. You really want to let them know that they may be entitled to these benefits if something happens to you, that the Victim Compensation Fund will provide death benefits, very important ones to them, and empower them to seek the help they need. Families are often, they're grieving, they're frightened, they're overwhelmed. So make sure they know where to go for help and make sure they know what they're entitled to. We suggest that even if you're not sick now, you get your proof of presence in order for your family. It's harder for them to do it than it is for you with all of your DSNY connections. It's something to do now. It's not something to leave for them if you can. And we also suggest that everybody get a will. And the reason is, it's the person you name as your executor who will have the right to bring the Victim Compensation Fund wrongful death claim. And so you want to make sure that's the person who should be bringing it. And you can also direct where some part of that award goes. Don't think that the law is going to allocate that money the way you want it. If you don't have a will, your part of this award is going to pass by a statute that you didn't write and that you have no say in. So get a will. It's important for your family.
Thank you guys so much for joining us. Good night, everybody. It was great seeing you.